Let's look at staffing. In 2020, we had 69 nurses. Currently, we have 124 nurses, and we're in a few days, we're going to get some more nurses because we finished 19 NAs on the hybrid programs. And we also just graduated 24 new NAs from the hinterland training program. This has never happened before. Adding to that, we've added over 102 CHWs to the system. Communities that never had health workers, Barbina, Cans Hill, these communities never had health workers. They now have 2 health workers, 3 health workers, and some of the health workers that graduated in 2021 are now upgrading themselves to being nursing assistant and registered nurses. This is a model that has been set in these hinterland areas to show people that it is possible to improve your state of being. And this is being seen all over. Look at Baramita. In 2020, when I visited Baramita, the floorboards, and I kid you not, the floorboards were this big apart. You could have seen straight through to the ground. Right now, you need to see Baramita. Serving a population of over 4,000 persons, Baramita has one of the, to me, a very, very, very good service for any hinterland region. We have a doctor, we have medics, we have nurses, we have midwife. The hospital there now have departments. They service the community. This is what we see happening in Baramita. We have persons from Baramita that are now trained as microscopists, CHWs, nursing assistant. In a few days, we're going to get a medics that is graduating from the University of Guyana, the associate's degree program. That medics is from Baramita. His name is Hakeem Henry. He'll be going right back to Baramita. This is now a role model for the people of Baramita. We are motivating people to making them better. We don't have a perfect system. I'm not going to say that we have a perfect system, but let's reflect of where the system came from. And that is how you'll see the amount of emphasis that has been placed in healthcare and in all the facets of society. When I was in Region 1 in 2020, we had 1 ambulance in Mabaruma, 1 ambulance. Right now we have 6 ambulances, that's ground ambulance alone, and 3 water ambulance. We have even put an ambulance at a village way up the Barama in Kariako. These places never had ambulance access. They don't have anywhere to reach Kariako through the river alone. Now you have a water ambulance there, and there's a way for persons to access health care. This is what you call transformative healthcare services. And I'm proud to be a part of this system. I'm proud to see the system grow. I'm proud to grow with the system. I'm proud to be, serving under the leadership of His Excellency Dr. Mohamed Irfan Ali and the Minister of Health, Dr. Frank Anthony. Their motivation and the drive, that's what motivates you. Because you know that there's a force behind you that is pushing you. And that force is what gives you the energy to push forward and move on. I can go on and on about the facilities and infrastructure investment in Region 1. Every single facility would have benefited from some sort of improved infrastructure. But I want to focus on the larger facilities like in Whitewater. Whitewater controls 2 landings, the Gaja landing and the Bamboo landing. These areas are very close to a bordering community, Venezuela. When I visited Whitewater a few years, I think in 2020 during the COVID crisis, Whitewater was horrible. Horrible. That's what you could describe it as. I want us to visit Whitewater now. We're currently transforming Whitewater into a polyclinic. But the center that's there offering service, you have a medics that is full-time there at Whitewater. You have nurses, you have CHWs, you have microscopists, you have a pharmacy, you have a telemedicine site. All of this there is offering at Whitewater. We want to, with the addition of the polyclinic, we're going to add a diagnostic wing. They'll have a lab, they'll have an X-ray, a portable X-ray unit, and they'll also have the dental department there. Back in 2020, these things were never there. Baramita never had a dental clinic. They have a dental clinic now. We had 1 lab in that region, 1 lab at Mabaruma alone. We have 4 labs now. We had 1 X-ray unit at Mabaruma alone. All 3 of the sub-regions now have X-ray units. all three of the sub-regions can benefit from ultrasound. We only had one ultrasound. There was one theater at Mabaruma Hospital alone, and it wasn't functional. That theater is now running 24/7s with a full complement of surgeons, gynecologists, and orthopedic surgeons. We had 2 specialists when I got to that region. We have 6 now, and we've extended specialty services to Comaka District Hospital also. We're doing surgeries in Comaka, lab services, all of that is being offered at Comaka. So I want to summarize this by saying that this is the best example that I can see of something that is pro-people, pro-poor, and productive.